Mm.
All right, everybody. Hey, this is Dr. Ryan, and we're here with Dr. Thomas Rohde. He's a friend of mine. We've been acquaintances and become friends over the past, let's just say, year, just to keep it easy. We both run integrative clinics. He's a medical doctor, whereas obviously I'm a chiropractor. And so, it's just great that we can get his expertise. He's highly trained in functional medicine. He's been doing this for years and helps a lot of people. He practices out of Decatur, Illinois, my college alma mater hometown. So I went to Millikan. So, there's connections all over the place. But so, Doc, thanks for coming on.
Well, thanks for having me. I appreciate it. I like the kind words too. Thanks.
What's that? Oh, yeah, you're a smart guy. Huh?
Yeah, sure.
Get the smart guys on here so we can learn what's going on. So, so like we talked about before we jumped on, we're really just trying, one of the big goals of these podcasts are to help people figure out their way through this, and not just to treat one thing, but to ultimately strengthen their immune system, because treating anything, prevention's worth an ounce of prevention's worth a pound of cure, right? So,
Right.
In your opinion right now, what are some things that you and your wife and your staff, and also that you're directing your patients to do to not only just try to treat one thing, but trying to stay healthy overall, strengthen their immune system, et cetera?
Well, what are we doing personally? I always think gut health is important. And my wife and I are both gluten intolerant. So we're gluten-free. We eat a pretty grain-free diet most of the time. Really do intermittent fasting most of the time. For me, intermittent fasting means my cup of coffee in the morning with a little heavy cream in it. And then for lunch, I'll usually have a salad with some sort of leftover meat from dinners prior on it. And then in the evening, like this evening, we had salmon with some broccoli, and all healthy foods. And really, I think that's the biggest thing that people need to think about going forward is, we're going to have another virus, whether it's the influenza or another different offshoot that we've never seen before in the fall. And what are we going to do? We need to really work on getting ourselves healthy. And so the things we're doing, obviously I take some supplements to augment that. I take my multivitamins, some fish oil. We do our own kombucha, which is great to keep gut bacteria healthy. I still take a probiotic as well. And then with this whole viral thing, I've added in some extra vitamin C, a little extra zinc, which is good for us as guys, for prostate health, and kicked up a few extra supplements to keep our gut healthy. And then because I do functional medicine, we do a lot of IV treatments in the office. I have access to ozone. So I've got a small ozone generator at home, and I don't know how people will like this, but I do rectal ozone at home 3 days a week. And that's
That'll keep
simple modality. Everybody thinks, well, that's disgusting. How can you talk about this stuff? And I said, hey, I'm just trying to keep healthy. And sometimes you got to do drastic things. I don't think it's that drastic. It really is a very simple thing to do. It takes a couple of minutes in the morning to do that. And if that keeps me healthy, keeps my immune system in great shape, I'm willing to do that stuff. And I think that's important.
Yeah, absolutely. We have an ozonator in our practice as well. I know you're a big ozone guy. So we'll just, so first off, you mentioned gut health. Obviously, we believe nutrition is very important.
Absolutely.
Avoiding gluten. It sounds like you don't eat too much sugar as well.
We try to avoid that. I mean, I hate to say it. I think everybody should have a little chocolate every day. I think that's good for your mood.
All right.
So I'm sticking to that story. That's like my cup of coffee in the morning.
You like everybody to have a big Snickers bar, one of the big ones?
No. I'm talking about not a Snickers bar. I'm talking about maybe some 70% chocolate, something like that. So too many other good ingredients in those Snickers bars. I'll leave those for everybody else that eats what I would call the SAD diet, or the standard American diet. I think that fits better in their grocery cart.
There you go. All right. So nutrition, obviously paramount. You got to build everything from there. You can't eat crap and expect for good health. But you mentioned gut health. I know that we've talked numerous times about keeping a healthy gut, and what comes with that, or potential leaky gut, or SIBO, or overgrowth of non-beneficial bacteria or candida, et cetera. So why don't we jump into that a little bit? We didn't talk about that in our previous one. So what are some things that you look for? So let's just say someone comes in with some immune system issues, or they're just fighting different things. If you're going to start there.
Well, I've always told people if you don't test, you're really just guessing at what's going on. You can go by clinical symptoms and get some idea what's going on. But some of the testing we do now has DNA signature technology. The GI map that we use in the office is amazing. And it's crazy, some of the things that I pick up that you would never guess. I mean, people that traveled out of the country 7 or 8 years ago, and they turn up with some pathogen or a parasite that's been riding around with them for years. And
7 or 8 years, really?
absolutely. I had a lady that came to see me. She immigrated to the United States from, I don't know, it was Nicaragua or someplace like that 20 years ago. She'd been told she has irritable bowel, had numerous scopes, all kinds of medicine for gut. Turned out she had some parasite I'd never even heard of before. I had to look it up in a book. And then we figured out she had this parasite. I don't even remember what it is now. It's been a year or more that we did this. And I actually had to find medicine for compassionate use for her to take. But the crazy thing is, she took her medicine. She came back to see me 3 weeks later, and she said, I feel normal again. My gut hasn't been this good in 20 years. I mean, literally.
Wow.
And it's crazy. And, I had another gal, she works at the hospital. She went to Belize on vacation. When she got home, she had gut stuff. And so I always ask people if they go on a trip or travel outside of the country, and people travel all over, did you get gut sick when you're gone? In Mexico, we call it the turista. I don't know what you want to call it anywhere else. But she treated herself with diet, things settled down, but then a year and a half later, her symptoms flared up again, and she couldn't get it fixed with her diet change again. And she came in, and she literally had a parasite she picked up in Mexico, had been traveling with her.
I'll be darned.
So you bring extra baggage home you don't know about. But, you talked about bacterial imbalance. You talked about SIBO, which is basically bacteria in the wrong location. And you can figure that all out with testing, and you can make a big difference for people in a fairly quick amount of time. I had a gal in today that had E. coli, the type you get really bad food poisoning from. And she's been dealing with us. She said 2 years she'd come in, 2 years she'd been dealing with this. She was going to a party, and she was going to go pick up one of those pre-made salads from the deli at the grocery store. And she got sick after she ate that. And she'd been through different antibiotics. She'd seen her gastroenterologist and that. And same thing, she still had the E. coli in her gut. And we treated it. And again, 3 weeks later, she's a completely different person. And so with that knowledge, it makes a big difference. And I know nobody likes to play in their poop, but then I'm an odd guy, do rectal ozone, right? I just told you that. But if you can get people to do a specimen, you can really get some idea what's going on. And it makes a big difference rather than just guessing.
So you do a lot of like fecal testing then in your practice?
That's, anybody that comes in with a new patient that has autoimmune disease, anybody that comes in that's had any sort of gut complaints, we just almost automatically do a stool test anymore, just because that's where everything begins.
Gotcha.
And I guess a simple way to think about it, I tell people, if you drive a gasoline car and you pull up to the gas station, maybe you're talking on the cell phone and you're not paying attention, you put diesel in it by mistake, it's not going to run very well. You're going to get out of the gas station.
I've actually done that on accident. I was in a hurry and my car didn't make it to the road. That was an expensive tank of gas.
It is, but it's the same thing. Like you said, you can't expect good outcomes if you put bad stuff in. And, during this whole pandemic thing, going to the store has been a little interesting because, look at what people are buying to eat. That's all the pizzas and the chips and the sodas and all that stuff. And it's like, it's no wonder that people are worried about getting sick because they're not taking care of their health. And so simple dietary changes are amazing.
Yeah, it's pretty wild that the canned food aisle and the chip aisle is about empty, and then the fresh vegetables, it doesn't even look anybody's even touched it yet.
Yeah, so, educating them about that. So, once we have some testing back, we can figure out what we need to do treatment-wise for it. A lot of times we can use natural supplements to help heal the gut. I do a lot of high-dose probiotics too. That's a good thing to do as well. But getting the gut fixed makes a big difference for immune health. And, if we figure out 70 to 80% of our immune system resides in our gut, it's really important.
Yeah, absolutely. And yeah, just once you get it fit, once you get it working properly, keeping it working properly.
Yep, and that's just putting good stuff in all the time.
Sure. So you make your own kombucha, huh?
Yes, we do. And my wife usually has about 2 gallons brewing in the kitchen, and then we always have second fermentation. So my kitchen looks like a beer brewery, literally, but it's all kombucha. It's all healthy stuff.
There you go.
Um, and the second flavorings are great. I actually had a lady that came in the other day, and she'd bought some at the store, and she didn't like it. Ann gave her a sample of our latest batch. It has organic cherry juice in it. It was really good. It tastes like a cherry soda. And she said, "Man, I want to buy some of that. That's good." So, you can come up with all kinds of things. We put ginger in it. We cut organic blueberries. You can flavor it with just about anything.
Huh. That's I can't say I've ever done that, but I try to find if I'm going to drink kombucha. I know if you get it at the store, it's a lot of it's got a lot of sugar in it.
Yes, it does, and you got to be careful with that. Well, next time I come down to visit, I'll bring you a bottle of my homemade hooch. How's that sound?
There you go, buddy. I'll give you some deer sausage, and you can have some.
Right.
I'll take some hooch.
Great.
That's good. So, all right. So, first off, I mean, we're going to be wanting to make sure people have a healthy gut. So,
Right.
healthy gut's going to help to stimulate a healthy immune system. Obviously, like you said, what
Correct.
70% is going to be stimulated by those little healthy babies, those little bacteria floating around in our gut and attaching in our gut. I mean, don't those the bacteria in there also help us actually digest and even create certain vitamins, don't they?
Absolutely. I mean, they make vitamin K, so it helps keep our clotting in shape, our bone health, our immune system. I don't know if anybody has ever heard of Clostridium difficile, which is an overgrowth of a bad bacteria if you take antibiotics or something. And I actually had the brother of a patient of mine that died in the ICU because they couldn't get his diarrhea from that fixed. And what we're doing for some people, because of all these antibiotic, what do you call them, resistances, they're doing fecal transplants. And so very interesting. I mean, you're taking somebody else's poop and putting it in your body to fix your colon again, reimplant healthy bacteria. One of the things we figured out is we're really transplanting DNA too, I think, the bacterial DNA, because they're actually, and the FDA got after people because what happens if you have a skinny patient and you put poop from a fat person in them, they start gaining weight, and vice versa. If you get a fat patient, you give a skinny person bacteria. So it controls our metabolism as well. And there's actually some clinics that started up of all places in California where you could go and get a different person's poop to lose weight. So the FDA shut that down, but they affect how we think, how we function, so it affects mood as well. And it's amazing. The bacteria are more important probably than our own DNA. So I don't know. Crazy stuff.
There's a lot of serotonin's developed in the gut, correct?
Absolutely. The majority of our brain chemicals are made in the gut. And so there's a direct connection, gut-brain connection with that. And so healthy gut bacteria. I had a lady that came back today for a follow-up that had problems with anxiety. And actually her husband brought her in for me to fix. And she came back and she said, ever since we got my gut fixed up, she said, I'm not having any more of my crazy spells, as she calls them. And so her husband was really happy about that.
Yeah, that is fun. Well, interesting. So you're doing a lot of gut work then. Do you use ozone for gut on a lot of your patients?
We can do ozone for that too. If we've got autoimmune disease tied with that, we do a lot of work with alternative help for people going through chemotherapy and that stuff can be pretty hard on the gut as well. So have them doing rectal ozone at home to help, boost the immune system or keep their immune system functional while they're trying to get their cancer treated. And so that's been helpful too.
So how is the rectal ozone increasing immunity? How is that helping strengthen the immunity?
Well, first of all, ozone is 3 oxygen molecules together, and the ozonides that are created when they go into the gut, first of all, you're oxygenating, but the ozonides also they're absorbed through the gut mucosa, and they get into the circulation, and those ozonides stimulate a healing response in the body. And so it's really not the ozone itself that's doing it, but the ozonides as they're transformed into that stimulate a healing response. And so we've had, really some great outcomes doing IV ozone. The rectal ozone is something people can do at home. So some crazy things we've had that people have improved doing the ozone at home. And it's really a simple thing to do. Using that to keep yourself healthy right now is easy to do as well. I know my daughter's doing that also. So we're kind of crazy in our family. So.
Hey, I'll tell you what, most people that are crazy, they're doing things differently, and that's a pretty good idea right now, I think.
Correct.
Not following the.
No, I've been outside the circle for a long time, so to speak.
Yeah, no, I'm with you. A lot of people said and I'm sure you get it too.
Oh, there are still a lot of traditional doctors that look down on us. I mean, some of the crazy things you hear. We do IV vitamin C. I know you do some of the IV treatments in the office as
Yeah,
well. And that was literally one of the things that worked to kill this COVID virus in Wuhan, China. And I've got the protocol to use in my office. And, the docs were starting to experiment with that in New York because they had all these sick people that came in, and the FBI came in to shut them down. And, that's just so frustrating when I see things like that. We have tools that could help with some of these things, and they're not accepted, they're actually rejected, mainly because they don't cause any side effects.
yeah, and nobody's making too much money on it, so they gotta make sure to lock that up.
Yeah, but so instead they're going to do some hydroxychloroquine that can cause side effects. But
Yeah,
again,
they're even trying to take that away, aren't they?
they're trying. But an interesting fact about that, it actually increases the zinc concentration in the cell, which is antiviral. So I think really honestly, for treating that or preventing the virus, that's one of the benefits of that.
Yeah.
And then decreasing that cytokine storm because it's an anti-inflammatory. That's why it's used for rheumatoid arthritis treatment too. So it's actually multifactorial, if you will, but it's going to have side effects with the heart, and vitamin C doesn't do that. So, simple stuff.
There you go. There you go. So what else? What are the things that you guys are doing that and not only like that, because like we were talking in the last podcast, one of my concerns is not where we're going to be in 30 days, but what could potentially happen in 90 to 120 days. It's when everybody starts getting out and everybody thinks, because the virus doesn't just run away. It doesn't just like pass through like the Passover in the Bible. And then it just, as long as you got your goat blood on the door, you're okay today. And as long as you wear your mask until May 31st, then you're okay. And then, you can go outside and lick door handles again. So what are things that you recommend to your patients to continue to do and just to constantly do? I mean, obviously diet's one. What are some other things that you guys?
Well, one of the things that I probably struggle with my hours that I keep is sleep, because sleep's important for your immune system. Getting regular restorative sleep, if you will. So if you're not sleeping soundly through the night, that affects your cortisol levels. And, cortisol directly reflects back on stress. How's your stress? And it's one of the things I did when I was doing some of my Facebook Lives for my people. I talked to them about turning the TV off, quit listening to all this stuff about the virus, and go outside and listen to the birds chirp, go walk for a sunshine, go do something with your kids. Because this 24/7 noise really kicks up your stress, and that stress suppresses your immune system. It can adversely affect your gut bacteria, actually. And so simple things like work on ways to decrease your stress. I've had people tell me I can't go to the gym. I'm used to working out at the gym 3 or 4 days a week, and I'm really stressed out. And I said, well, just get out and walk, or start jogging or something like that. There are plenty of things we can do where you don't have to go to a gym, but sleep is an important thing, and I think that's good. And then, putting together a reasonable supplement program. People spend lots of money on their Starbucks drive-through. And I think it would be a great investment, put $100 toward a reasonable supplement package to have that available to take all the time. And I tell people, multivitamin, probiotic, some vitamin D, those are 3 simple things you can add in, and maybe some fish oil too, because it's a great anti-inflammatory. But that's a great baseline to start with for people to take to be ready, because we know the next flu season is coming, just traditional flu in October. And so what are we going to do from September till March or April of next year? Are we going to be quarantined for 6 months this time around? How are we going to do this? And I really think we need to get prepared for that in advance.
Yeah. Do you guys have, you said you do IV therapy. Do you personally do an IV every once in a while, or do you not usually mess with it until you're?
I have been. I actually did a Facebook Live at noon one day. I just jump in there and had them plug me in with Myers cocktail, which is B vitamins, vitamin C, and boost that up. I've done something for the first responders in Decatur. I told them, hey, any of the first responders, so firefighters, police, and paramedics, you want to come through once a week and get a B12 shot, we can do that easily. We've offered a discount on Myers cocktails for people to come in. So anything we can do to help boost their immune system right now. is simple, but vitamin C is great. IV, we do that also. And I don't know, a lot of people just don't know about it is the big thing. And so that's why I've been trying to push out just getting people to understand what's available for them.
Sure. No, absolutely. And that's the thing, we have so many tools in our tool bag, especially in these integrated medical clinics. And
Right.
uh,
Well, it's just like you do adjustments that helps the immune system as well. So for
oh yeah,
people coming in having a regular adjustment done, I think that's great. You do the IVs as well in the office. So, those are all things we can offer people.
yeah,
It's just getting them to understand that those are beneficial.
right. You might as well pass, so you do IVs, you're a big gut guy. So when you're doing nutrition, what is because a lot of times I've heard as little as 15% of the supplements that we take get absorbed into the bloodstream.
Correct. That's correct. And that's the problem. And that's why I'm so big on getting the gut fixed first, because people come in and they may be taking, and I joke about this. Some people come in with a bag of supplements because they watch Dr. Oz and the doctors and they tell them, oh, you got to buy this supplement and that supplement. And they come in with all these supplements. And yet when I do some of the nutritional testing, we find out they're low in D and B and iron. And it's like, okay, so that tells me your gut's not absorbing all that stuff. Like you said, basically, they're putting a lot of stuff in, but it's not being absorbed very well. And
Right.
so if you can get the gut working more efficiently, they'll do a better job absorbing that. And even if you're eating organic food, if you don't digest it well, and I see so many people that lack enzymes to help with digestion, and that goes back to absorption. If you can't digest the food and the supplements, you're just going to end up with expensive poop.
Yeah. Yeah. Well, it's good for those fecal tests.
Yeah, I don't know who it's good for, but so that's why I'm so big on getting the gut fixed first.
Yeah.
That's really the first step for me.
Yeah. Let's see here. What other questions? Anything on your mind? Anything, and just what's going on that you're just wanting to preach from the mountaintops for some for folks to
I don't know
hear?
about preaching from the mountaintop, my biggest thing is just letting people know, and that's what I've been working on, is pushing out ideas. The body's designed to heal, and we can do things to help it recover from that. People with diabetes, why were they at higher risk for this? Well, simple. We can fix traditional diabetes. I mean, if you're a type 2 diabetic, all you got to do is cut back on the carbs. How about doing some intermittent fasting like I do, or even thinking about doing a 3-day fast, something like that? Because when you cut the calories down, that helps your body heal. It gives it time to really work on clearing out the junk you got stored up in your body and give your body a time to recycle, if you will. When you think about what's happening with the earth, in one way, this whole period of lockdown was great because the air was cleaner, the water seemed to be cleaner.
Yeah, it's crazy.
We're driving, and so the same thing happens with the body. I think if you give it a time to heal like that, and fasting is a great way to do that. I mean, in Europe and Germany, I know there's an oncologist doc that I want to go over and spend a little bit of time with. They're having some pretty good successes with extended fast treating cancer. It actually works better than any of the chemotherapy. And then they combine it with ozone. They combine it with some of those other, high dose vitamin C treatments as well. And they're having some pretty good outcomes with that. So I think fasting is a wonderful thing to add into the diet. We eat way too many calories because it's available all the time. And, we just kind of graze all the time, if you will.
Yeah, when you're not spending all that energy on trying to digest food, your body can focus on
On
healing and repair.
house cleaning, right? And a lot of the things we eat, actually, I would say, in simple terms, it gums up the liver, and so it can't do the housekeeping. So, if we do hormone testing, I see a lot of women that come in with an elevated estrogen level, which actually increases the risk for breast cancer and uterine cancer long term. And again, if you don't test, you don't know that. But if their liver is gummed up because they're drinking 6 diet sodas a day, and you can get rid of those artificial sweeteners and the liver starts working better, do some cleanses with that, add a few supplements in. A lot of times you can work on improving their hormonal balance just by doing that also.
Hmm.
So again, housekeeping is important.
Yeah. No, and you get the machine running right, the immune system.
Yeah.
So
And so that's, the big thing is I just want to get the word out to people that we have all these opportunities for them to help improve their own health. And a lot of this doesn't require anything. People say, well, but it's expensive to eat. Well, yeah. Okay. But if you haven't got your health, what have you got? I mean, I think the best investment I can think of for people making is to work on the foundation, and keep their gut healthy, their immune system healthy, and then it helps prevent things. I mean, if you don't go to the doctor 3 times or 4 times a year because your blood sugar is out of control, how much money does that cost you? You
Yeah,
know, if
not
you
to
avoid
mention
that.
lost enjoyment, lost quality of life, or you're just laying around, you feel
Correct. Yep.
and you don't want to
Yeah,
do.
you know, I don't know. I see my job as a doctor really educating people and working myself out of a job. It's kind of like parents do. You know, we raise our kids up, and if we do a good job, we work ourselves out of a job. And that's kind of what I see my job is to educate people and help them work myself out of a job. You know, they should be able to pick up the ball and take care of it. Maybe come in and see me once in a while for a little boost or something like that.
Yeah.
But once people really understand that, and I guess that's the biggest thing is people just don't understand that the stuff they're buying at the store isn't healthy for them. You know, you think about some of the foods. We all live in Illinois, and you think about some of the uh, chemicals that get sprayed on the fields, and those interfere with immune function too. The glyphosate is my particular one that I dislike. A lot of people don't understand. You know, they all say, "Well, glyphosate is perfectly fine. You could drink it." Yeah, but if you do that, it's going to kill your gut bacteria. But it's on residues, you know. So part of my reason for being pretty much grain free is we just avoid all the grains that are grown in this country. They have the glyphosate residues, and glyphosate is antibacterial. So the wheat crop gets sprayed with that before it's harvested, but you've got all those Roundup residues. And so every time you eat something with wheat produced in the United States on it, you're killing some of your gut bacteria because it's antibacterial. That's how it kills the weed, by hitting that pathway that generates energy for the plant as a bacterial pathway. And it kills our gut bacteria. And the end result is such a huge increase in autoimmune disease. And that's because every time you eat those things, you get a little bit from this food, a little bit from that food, a little bit from here, and you're damaging your gut bacteria. And that ultimately ends up injuring the immune system. All I have to do is turn on the TV at night and see somebody selling something for some autoimmune disease.
Oh man, they're everywhere. Just
They are.
you have people that are just chronically pain. They're just hurting all over, and they can't figure it
Yep.
out. They're just
Yep. They're inflamed, and you know, same thing. So that's good for you. You can help them out with that, right? You get people out of pain all the time.
that's the goal. That's the goal. Sometimes they got to do a little work on their end too, though. It's
Absolutely, they do. But unfortunately, Americans like those pills to get at Walgreens and CVS, and that's why they're on every corner. But you
there's
know, if
still
we,
plenty of them out there that want to.
yeah, no, and I think people are getting smarter because they're tired of having side effects of medications and that. So
Absolutely. I'm with you. So, any final words or anything that you can think of that, I mean, you've ran through a lot of different information. You're going to have people's heads, if they're taking notes, their heads are going to be exploding with
well,
this.
I hope not. But you know, just there's so much information available out there on the internet. I think everybody's trying to help educate people right now. I think that's really great. Avail yourself of that. I've got stuff on my website. I'm sure you've got stuff on your website.
What is your website? What's the name of your website?
drrohde.com, drrohde.com. So if they want to go there, we push stuff out. You know, we have educational, some of the not podcasts, but some of the Facebook lives I've done, we've got posted on there on immune health. I've got my list of supplements that are on there. We're going to be pushing out some other resources for how to make sure you're getting clean water. You know, that's an important thing because everybody assumes water is okay. But again, you know, I like a little bit cleaner water than most people think is okay. And so we're going to start posting more of those things on the website as well, because again, it's a lack of understanding.
Sure. Awesome, Doc. Well, I'll tell you what, I appreciate your time. I know you have a busy, busy week and a busy, busy schedule. So thank you so much for taking the time.
Yeah, I love doing stuff like this. I love to help people understand. Like I said, my job is to educate people, and I love that. It's just like you. Every time they come in, they get a whole lot more than they pay for. Is they get some education. Well, no, seriously, and that's what we should be doing. You know.
Well, that's why I reached out to your wife, because I knew she'd answer my emails and phone calls. So
Yeah, the only time I do that's the end of the day. I don't have time.
I know I know your day sometimes is at 4 a.m. and I'm
No, that's when it begins. So.
said you were up the other night doing notes till like 4 o'clock in the morning or something.
Yeah, no. I wasn't up till 4 a.m. I went to bed at 10 and then I got up at 4 a.m. So,
All right, good deal. I was gonna say, man, that poor guy, he's gonna need some sleep.
yeah, well, and that's why I mentioned that. I told you I did that up front. I said, you know, that's one of my biggest problems is really working on getting enough sleep on a regular basis.
Yeah,
I do 7 or 8 hours a night. I do work on that.
good.
So at a minimum 7.
Good. Well, good deal, man. We need to keep you healthy. We need to keep guys like you out there healthy as you
We'll
take
keep
care
working on it.
of.
Well, Ryan, thanks. I appreciate it. I love doing this kind of stuff. So, let me know if we want to do some other topics. I love
Yeah,
that. So,
absolutely. We absolutely will. So I like the gut stuff. So we'll, obviously you are passionate about it and you have a lot of knowledge. So we'll touch base here soon, but thank you for your time. God
hey,
bless
thank
you,
you
man. And
for having me on. Appreciate it.
in D-Town, and don't let that Staley air get to you too bad there. All right.
Yeah, I'll bring you some hooch when I come by.
That sounds good. I got a stick of deer sausage for you.
All right.
Dude, have a great night. Thank you again.
Stay healthy.
You too, sir. Bye-bye.
Bye.